We have arrived at the endocrine system. Here we're looking at the overview, part 1, page 592. And it should be noted here that the endocrine system is in, counterpoint to the exocrine system. So exocrine means that molecules of interest and signaling and function are delivered to spaces within the body through ducts. So saliva, sweat, of course, goes to the outside of the body. And then there are pancreatic fluids, for instance, going to the small intestine, whereas endocrine glands are glands that produce active molecules that enter into the interstitial spaces between cells and then also are taken up into the bloodstream. And so then can travel globally throughout the body and look for and bind to receptors specific for those active molecules. In some cases, we're considering molecules that would fit well into the neurotransmitter category. And so molecules that are adrenergic, for instance, would be epinephrine, norepinephrine. It turns out that the sympathetic nervous system using epinephrine and norepinephrine is more than 50% blood-borne and less than 50% hardwired and delivered to synapses. But nevertheless, there are many molecules that serve multiple functions. So oxytocin, for instance, in the central nervous system is a neurotransmitter, and in the body, throughout the body, especially in female systems, binding to the uterus and to the portions of the breast, oxytocin could be then viewed as more in the endocrine category. Okay, so 40 to 50 trillion cells, all looking for their molecules of interest and action. And then also every single cell in the body participates in this work. And so we have this big overview as a handout here, and we're looking at, now this is from, of course, a pathology book, but basically what we're looking at here is that we're looking at all cell membranes made out of phospholipids, of course, and then we take a phospholipase and we can get a single fatty acid of 8 carbons in length, and that's arachidonic acid. And this is the key, aspect of this biochemical outcome. And so we have, in this case, if we go this way, we end up with prostaglandins. Prostaglandins ultimately gets to this very, universal prostaglandin, PGE. This actually activates the effects of histamine. It activates the effects here of pain through bradykinin, and there are many other inflammatory actions that PGE takes. Some of these other ones are balancing the viscosity, the thinness or the thickness, as it were, of the blood. And so this is regulated here at this particular enzyme called cyclooxygenase, or COX for abbreviated purposes. There are such things as COX inhibitors that inhibit this cyclooxygenase, and those would be items that are akin to aspirin or ibuprofen. Okay, so we can sort of regulate this aspect. Aspirin has the added advantage of actually disabling platelets. Then if we go to a higher level here and we look at the phospholipase, we can regulate that through our own internal chemistry. Every night we have cortisol that comes to us and guides the work and activity of pituitary growth hormone, as well as the growth factors that arise from the liver and are, instigated by growth hormone. So we can actually use this item. This can come to us also as prednisone, a synthetic used in the healthcare universe. And we can turn off everything from here, which would turn off the prostaglandins. But oftentimes we're targeting over here the leukotrienes. These would be items that involve anaphylaxis. So if somebody has a particularly difficult or severe inflammatory experience, an anaphylactic experience, which could be something related to asthma or to bee stings or to reactions to hypersensitivities, extreme immediate type hypersensitivities. Sometimes the effects here are thousands of times more powerful than ordinary histamines, and so some of these molecules are extraordinary in their strength, some relatively mild. It just depends. Here we see complement portions or molecules that break off of C5 and C3. So C3A, C5A actually activate this anaphylactic side of the equation here. So this is coming from the cell membrane of all cells, and I want you to realize that hormones can function in this regard too, on just a cellular or limited tissue level. And we see this, of course, in our current pandemic that's going on right now with regard to COVID-19. Okay, so there is that situation. Here we have someone demonstrating some of the organs and major tissues that we're considering. For instance, in the brain, we have the hypothalamus and the pituitary gland. So they are side by side, and we'll take a look at those early on. There's the thyroid gland that secretes thyroxine. This is actually a gland not for someone of this more mature or adult age. This is a gland that exists mainly from childbirth to puberty, and it is the thymus. Then we have sitting upon the kidneys here are the adrenal glands, or sometimes called suprarenal glands. And they have a number of molecules, particularly steroids out in the cortex, that we'll be looking at, aldosterone and cortisol we just looked at, and also male and female sex hormones and precursors to those, including DHEA. Then we have the pancreas here. The pancreas is mainly an organ that produces enzymes for digestion, but in addition to that, there are some small areas within the pancreas that are interlaced with capillaries and called islets of Langerhans, and they contain alpha and beta cells. The alpha cells are for glucagon, the beta cells for insulin, and we'll be taking a look at those complementary molecules and their effect on glucose. And then, of course, we have either an ovary or a testis that produce various amounts of hormones. In the case of the female, we have progesterone and estrogen. One could say that the progesterone is a modification of cholesterol along the biosynthetic pathway. The next thing that you could get to is testosterone. Beyond that, you would get to estrogen. So one could say that the progesterone is a very macho molecule and the estrogen is a very feminine molecule, and that women have an ongoing shift in balance between these two molecules depending on the time of the monthly cycle. Males attempt a more tonic experience by having just the intermediate molecule, testosterone, that causes a somewhat more tonic outcome and experience. We'll take a look at that. Okay. Ultimately, in terms of language, neurotransmission, and so on, males do have to modify their testosterone to become some level of estradiol or estrogen in the brain in order to have speech and language function. So that would be something that we would look at in terms of central nervous system brain function.